Good morning, and you should have just received an updates from Strategies for Children in your inbox. If you haven't, then you're not on our email list or it's in your junk folder. So I'll put that link in chat. But we kind of previewed what's happening on the 9:30 call. We know the secretary and the commissioner are both coming on next week. So it's a great way to stay connected. And so just make sure you're on that email list. And as folks are joining, we also know that today at 10 a.m., the Mass Taxpayers Foundation will have a virtual event to review the governor's proposal for the FY26 state budget. And then Victoria will be in the 9:30 call Thursday. And then next week on February 12th, we're partnering with Neighborhood Villages on a kind of follow-up meeting around kind of talking about the budget, what it means to folks if you have specific questions. So please join us for that. Thank you, Neri. Put the link in the chat for the connections that we've shared. And then we'll put the link in for the event next week. And Victoria said they are recording the event at 10 a.m. today. So if you can't join it, sign up so you'll make sure you get the recording and the follow-up email. And we're so happy to welcome back to the 9:30 call, Amanda Saillant, who we'd love to hear a little bit about you, how you came to be in your current role, and then an update on the report that you released.
Sure. Thanks, Amy. Hi, SFC and 930 callers. So happy to be back here with you. Um, I'm nervous, but I think it's fine.
I
Um,
was thinking of you. Everyone gets nervous. Take
yeah,
a deep breath. We are here for you, Amanda.
thank you. Um, I'll start with how I came to be in my current role.
Great.
I am Massachusetts born and bred. I grew up in Sutton in Central Mass. I went to UMass Amherst. I then became an early childhood educator. I worked in kindergarten in Springfield, and then as a public preschool teacher in Somerville. Wanted to live and work abroad. And so then I taught at an international school for 4 years. And while I was there, learned a little bit about the systems that are prohibitive, right, in accessing quality education, both for our youngest learners and then for adult learners. I worked with refugees in Indonesia pursuing their GED, and just like saw this whole spectrum that I didn't see before from the classroom. That was like, there are so many challenges in the way of the progress that we seek to make with education. So I went to graduate school, I studied education policy at Harvard, did some work with I was a Zance scholar and did some work with them on the Navigator. Came to the end of my year and realized, okay, I had learned a lot about policy and how you craft good policy, but then realized I didn't quite know a lot about implementing it or putting it into action, which led me to Amy and the team at SFC, which then they were so fortunate to have me aboard. And I spent 9 months with the team on the early childhood agenda. It was really a wonderful learning opportunity. And that's what led me to this role at First Children's Finance. Where I am on the national systems team. We work with state and tribal governments to support their research and other consultation efforts in support of their early childhood systems.
Thanks so much, Amanda. And we almost had Amanda as an intern when she was at Zance, but Noni pulled her back in. But then Amanda, as she said, worked on oh my God, what's the name of it? What did you work on? The study? No,
Yes.
what did you just say?
Oh, the Navigator.
The
The Zance
Navigator,
Navigator was
yes.
my baby. Yeah.
But if
Um,
folks remember, we had Amanda and Jeremy who really were so instrumental in the launch and the kind of the continuation of the early childhood agenda. We learned so much and appreciated their perspective. And I think I see we have Eisner, one of our interns from DC is here. See Eisner, people come back to strategies. Um, so Amanda, tell us a little bit about kind of your new role. So when did you start there?
so I started here in April. First
Okay.
Children's Finance is based out of Minnesota, but as on the national systems team, we have folks across the country. My director lives in Methuen. Um, so we have Massachusetts connections everywhere. And when I started that first summer, this project that I'm going to share with you today was the first project that was really shared with me. It was in consultation with the National Children's Facilities Network, where they contracted us to do a study looking across, I know, always Massachusetts connections, looking across funding streams, ARPA, COVID-related funding, to see like what went to states and communities in support of early childhood facilities. Facilities like super broadly, that could be business development, that could also be new construction, major renovation, minor renovation, etc. So I have some slides if we're good to
Yep,
go.
we are.
Yeah,
And as folks might know, and I see Kara Wilkie is here from the Children's Investment Fund,
that's right.
and I am the president of the board, and Wayne Isagari is also here. He's the vice president of the Children's Investment Fund board that has really been working on facilities in Massachusetts for a long time. So, all right, back to you, Amanda. Slides are up. We can see your notes page,
Better?
and
Notes
now we're
gone?
back. Yep, perfect.
Okay, cool, cool. So ooh, here we go. Okay, so I'm just going to share with you a brief overview of what we found, what we studied. So again, we're talking about facilities capacity in a really broad spectrum. So that could be repairs all the way to new investments to technology. And we wanted to capture the breadth of approaches and also as much detail as we could about what funding went where and how it was used. Some of that was more challenging than others, right? This started with desk research of CCDF ARPA plans. The BUILD initiative has this wonderful archive of stabilization funding that each of the states put out about what were eligible uses for their stabilization funds. Then I did a lot of poring over state and local fiscal recovery funds. All of those had to be reported to the Treasury. And I coded that for anything that included childcare, daycare, early learning, anything that would fall into those broad categories. We also reached out to CCDF administrators, Head Start collaboration directors, small business small business credit initiative implementing agencies to hear more from them. We got roughly 30 responses from CCDF administrators. And so we used that data to learn more about what happened in their states. And then we did some case studies, which I think is actually show some really interesting uses for this funding. And some broad findings. So from the CCDF administrators that we reached out to, roughly, I think 32 of them responded, and they shared with us a wide range of projects that they had that we categorized into startup grants, expansion grants, maintenance, materials, QRIS, or technical assistance. States had $15 billion to obligate by September 23 and liquidate by 24. And 27 states, so over half, confirmed these facilities grants programs. We also saw that the most common use was expansion and that there were fewer maintenance grants along the way, which is kind of what we really know that the field needs, just those maintenance updates. And looking at those grants, we saw that states either didn't know or didn't have capacity or weren't really able to prioritize any types of care. So some states had to focus on childcare deserts or infants and toddler seats, but if you remember back to this time, there was kind of a mad dash to get that money out the door. Some state agencies didn't quite know how to, or didn't structure it in a way that specifically targeted different types of care. 65% of the initiatives reported using an intermediary to support programs as they applied for these grants. And what we saw consistently along the way was that there were different requirements for centers compared to family childcare programs that I think what I would term to be not super equitable all the time, but family childcare as it's in your home poses different funding restrictions, right, for how you can do those updates. State and local fiscal recovery funds had a wide range of uses. States could allocate them, but then also municipalities or local communities. And there weren't the same restrictions on those large scale projects, so major renovations or property acquisitions or new facility construction. So we were kind of hoping to see more of that here. given that we know that there's so many childcare deserts and there are so many places that need more programming. Um, but instead, what we found was this like wonderful focus on expansion. 13 states had statewide funded projects, but there were many, many, many more local projects focused on childcare programs.
Hmm.
Um, and I think all along, what we were trying to find was like, what is the dollar amount? Is there a dollar amount that was spent on childcare programming? And just given the nature of those CCDF supplemental and stabilization grants, there wasn't quite as much reporting requirements for states. And so putting a dollar amount on that was really challenging. But with SLRF projects, we were able to put a dollar amount and say, okay, over $1 billion went into supporting childcare, which I would take as a win, not enough. Um,
It's so
but it's
interesting when you think about, like you've said, the context, but even the reporting requirements, which a lot of people, think, oh my God, that's such a pain. But then you think of the result of that when you're trying to put together the data to
yeah,
just kind of answer some simple questions. Because I think we often hear this and like we don't have the data, we don't have the information. But if we're not asking for it to be reported in a certain way or all of those pieces. I see that the Southeast PDC team has their hand up. Did you want to get in and ask a question? Okay.
all right.
We'll also, if you want to put things in chat.
Yeah.
So Wayne also had a question. What is the difference between new facility construction versus creation?
Yeah, it was really hard. I think that's a great question, Wayne. And in the report, we have a definition for each of the project categories that's there. It was really hard to delineate between the the language that was used to report in these SLRFs, and some of the language said specifically like, okay, Amy's childcare is going to build a new property or a new facility, and it's like, great, that's construction. Versus Amy's childcare is going to consider expanding into this new location. And so it's like, did they? What exactly did they use those funds for? Did they start a new business? It wasn't always super clear. And so we tried to say like, no, that a facility was going to be built versus hopefully a facility was going to be created or a program was going to be created.
And I just
And
put the
then,
links in chat.
oh,
So about the
thank you.
personal finance and then the report.
Yes, it's a long report, but I think there are some great tables in there with some good information. And I
Right?
wanted to just, before I got to the recommendations, a quick look at the big picture, and then I'll look at some case studies that I think were really interesting.
Right?
So we had 38 states developed this dedicated statewide initiative using one or a combination of the funding streams, which we were really excited about. Several states took this really strategic approach where they thought um, really carefully about what funding was going to be put in place, when and how, and then were able to not be duplicative in those efforts. So it was really evident that someone at the state level thought through carefully how they were going to support their early childhood field using different blending and braiding techniques. And our organization works frequently with tribal nations, and we really wanted to include an example in this report, but just given the turnover and the many hats that tribal leaders wear, it was really hard to report adequately on any projects with tribal communities. I wanted to highlight some of the case studies that we did. I think that they're really interesting. So in New Jersey, they use SLRF and state funding. They have, where are my notes? It's so exciting. Seat expansion wasn't one of their explicit goals. They wanted to support businesses to renovate their spaces, update them. We know that childcare businesses don't often have that additional funding to put into those minor repairs or improvements. But through doing so, since as of it was roughly a year ago, they've created over 3,000 new infant and toddler seats just through renovation and improvement alone. So those were
Wow.
spaces where maybe programs, maybe the acoustics weren't great, maybe the lighting wasn't great, maybe they didn't have a sprinkler system, so they couldn't create those seats. But what we found is um, in doing these improvements, programs were excited or able to bring in more kids and families, and staff was more enthusiastic about working there. So I think that both of those things go hand in hand. You can't have classrooms without staff who are eager to lead those spaces. They just started working allocating grants for family childcare providers, so there's probably work to do there, but I think they have a good starting place. In Nevada, the department partnered with a real estate investment trust so to expand the number of family childcare providers. So at the beginning of the pandemic, there were fewer than 24 family childcare providers in the state, period.
Wow.
When looking at right, when looking into that, they learned that the number of children, I think that as an unlicensed provider, you can care for 4 children, but if you move up to licensure, you can care for 6. And so there wasn't a big incentive to bring folks into the formal licensing because they're given the requirements, there wasn't much of a financial incentive to care for those 2 more additional children.
Right.
The real estate investment trust found homes. They also found that some of the challenges were around rentals not being okay with childcare businesses, with housing HOA requirements. And so the real estate investment trust purchased homes, they retrofitted them, and then using some of the money from the state, furnished those childcare spaces. The state also supported those providers moving into licensure, doing the business planning and the needs around that, moving into that formal system. And so far, they have 12 new licensed providers who have a home, who have a business in their home that they have to continue being in service for X amount of years and meet requirements. But it's really exciting for that landscape. Is really novel approach. And then just Idaho, a place where we may not think of as having the most progressive policies. They were able to take some money and they created lots of new programming in support with business partnership. Everything that they did was revolved around this need to support economic conditions, which, you know, we have some feelings about that, but it was really exciting in terms of what they were able to do specifically in rural communities, at their hospitals, in their public school systems, to create programs that would allow and encourage folks to go work in those places. And so they're really excited about that. And we were happy to feature them as a place that did some good work. So the rest of the report has more information on some local examples of funding and how that has created new opportunities in terms of facilities. 2 in Michigan, one Head Start program and one outdoor learning program that I think are really interesting. And then some larger recommendations that we made for both state governments and also the federal government.
Great. Wow, Amanda. Thank you so much. And the link is,
Yeah,
and you'll send me the slides.
I will.
Donna Danette says purpose design built facilities can have tremendously positive impact on staff satisfaction as well as enrollment. Wayne wonders that 121 million in New Jersey, is that a one-time number or an allocation for a certain amount of years?
That was an allocation that they had for a certain amount of years. The governor has since added on to that budget. So there's some revolving work happening there, but so far, I think in their last email to us, they had obligated 100 million of that funding in over 500 centers.
Wow.
Yeah.
Kara wonders, were you able to look at the overall average medium dollar amount spent on improvements per center or program?
Yeah, we do have some data on that, Kira. Because it varied so widely, it was really hard to quantify in a way that seemed meaningful for the report. Some states took an approach that was per child spending, so 10,000 per child, 15,000 per child or per seat for a center, and some just wrote blank checks. And we have information that was some programs got $12,000 and some programs got $2 million, and not a lot of information in between. But I'm sure we could look into that a little bit more. I could share with you.
The Southeast PDC team says that's amazing. Lydia shared more information on CARE's REIT for anyone interested. from Mission Driven Finance. Purpose. Okay, then Kim Lucas added pre-pandemic, the city of Boston explored what it might be like to use city spaces to purpose build both centers or housing focused on FCCs in particular. The pandemic sidetracked this, but it's something that local governments or regions might consider. Kira said, thanks, just shows the variety of types and improvements that are needed everywhere from small to large. We see that in Massachusetts, where we have the
Exactly.
large $1 to $2 million, grants. We have small grants, and then there's also now a new addition for family childcare facility grants. So, and we know that each part of the system has its strengths and challenges, especially when you think about public financing for
Yeah.
facilities. Amanda, can you tell us, so you started in April, can you just tell us a little about the mechanics about like as now this researcher who's trying to look across states, tell us about the process. Like how do you find the information? Is it all online? Do you try to get to the state administrators? How do you figure out where this sits in state government? Just tell us a little bit about the process.
Yeah, I think this has been my first real foray into this type of research. And as I joined the team, they had already started, so I was just kind of plopped in the middle of it. Most of what my team works on, or the work that I've been involved in, is around cost modeling work. So we just submitted our cost model to the state of Vermont. We're working on an update for them and for the state of Minnesota. So that work is really interesting in terms of funding and creating typical programs to think about what is the actual cost of care, which we all know is so important and is not the market rate.
Right?
But that market rate continues to inform so much of what we do. What happened with this report, we have this database of CCTF administrators that we were just kind of like email blasting, like, please tell us about what you've done. We're so curious about what you've
Right.
done. How many responded? Not too many. Um, which was disappointing. We also reached out to those state small business credit initiatives. We heard back from 11, and only one said that they specifically reach out to childcare businesses to tell them, as a small business, you're eligible for what we can for financing.
Right.
So those were all not the most exciting responses. And then in the dissemination of this report, which is the period that we're in now, we've reached back out to those CCDF administrators to share, and along the way ask for updates, but to share with them that this report is coming out and we don't want you to be surprised. We've either featured this or you never responded. And so many of those folks have moved on. And that's what state government is, right? Like people are there for a time and then they continue on. And so I think it is the job of researchers to then say, like, what are the resources we have and what can we find that is reliable and valid, and do our best to share that with the wider community.
Thanks for that. It also just shows how important kind of outside groups like advocates are to also
Yep.
help collect this information or, who are the right people to connect to in state government. Because we know sometimes it can be hard. And we often get calls from either national or, organizations saying, we're trying to get in touch with somebody in Massachusetts. Can you help us? Because you want to make sure that you are sharing accurate information because we know that a lot of reports like this come out and there's things that say like Massachusetts is doing X or Nevada is doing X. So, and I think as advocates, we also always want to know the story behind the story. So, but it sounds like the case studies were a way for you to really dig deeper in
Yeah.
kind of what the numbers were telling you and then to see what the story was.
Yeah.
Edna has a question in chat. Curious to find out if you were able to find any info related to insurance regarding family childcare businesses. We're hearing this kind of bubbling up in Massachusetts.
Yeah, and now we heard this a lot. We've heard this a lot in our Vermont work, and especially in building those typical programs that we use for cost modeling, that those insurance costs are outrageous, growing exponentially. We have some anecdotal data. It is from a handful of programs, and then also a percentage increase from their previous year. So that gave us some idea for modeling. The CIAB, Commercial Insurance, that's the acronym. Um, Sorry, I don't remember what it is, but
That's okay.
we've been using them as a resource in terms of modeling what insurance costs are and how they've changed for providers. But have heard a lot about that. I just don't have any concrete info to give you, but other than programs everywhere are really struggling and thinking about it.
And at 9:30 callers, I've asked you to share some love and appreciation in the chat for Amanda. And Amanda, I just so appreciate that you kind of shared your nervousness. We are right now working to book all of the Advocacy Network participants who have
Yeah,
mixed feelings about coming on the 9:30
totally.
call, about I guess mixed levels of nervousness.
Yeah,
So Amanda, kind of where you sit, you know, your experience in the classroom, your experience at Harvard through Zans, and now at Strategies and what you're doing now, what kind of, how would you tell people to approach research or like digging into projects, like, because you were so instrumental in the agenda by kind of like observing things, coming up with ways that we could be active. So any advice for folks, or any final words here on the 9:30 call?
sure. I think thank you, Wayne, for putting in the what the acronym stands for. I appreciate it. I did this career transition, and Amy and strategies were a big part of that. But naming that, like, it was really nerve-wracking, but also the experience that I know that I have from working directly with kids and families has been instrumental to my approach to research and policy work. Um, Lots of people are way up here in the stratosphere and think that they can read policies, but they don't know what happens down here in the classroom with kids, with families, in your programs. And so I used to think of that as um, I didn't have the policy experience or I wasn't really well versed in this language. And so I thought of that as a detriment. But really, what my transition has taught me is that, like, all of the experience that I have is a strength. And so I would think that that is some of the great work that um, the advocacy network does, that you all do here together, is that continued learning and building on what you already know. So it can be a little scary, but also it's worth it for what you want. So I hope that's inspiring to someone.
I think so, Amanda. So glad to see you. Amanda was also, the report came out. I wanted to book her. We're so glad it was you that was able to come on the 9:30 call. Just appreciate all the work and the comprehensiveness of the work. I think I look forward to digging into the report and all the case studies. And I put the link in the chat. So the Mass Taxpayers event is starting right at 10. So jump on over to that Zoom. Amanda, thank you for putting your email in chat. Send me the slides. We'll post that, and we will see everyone tomorrow on the 9:30 call. Thanks again, Amanda.
Thank you all.
Take care.